Every year on February 4th, the world comes together to mark World Cancer Day. In 2025, Uganda joins the global community under the theme United in Goals, Unique in Our Needs. A call for collective action while recognizing the unique cancer challenges we face.
The burden of NCDs is very high, starting with the cancers, and specifically talking about cancer of the cervix. You find that for every 100,000 women, there are 56 women who present with the cancer of the cervix every year. And unfortunately, out of these, 41 of them die because of late presentation, late screening, and other factors.
Five years ago, we had around 500 new cancer patients. But when we came to last year, that is 2024, we had around 1,400 new cancer patients. Overall, number one cancer in the region is the cancer of the cervix. We've been blessed that we got a partner who has been helping us to scale up the screening of cervical cancer. These partners who came from Korea, over the year, and also they have increased the number of patients that we screen for cervical cancer. At the same time, treating the premalignant lesions. So we get quite a number of patients whose lesions are actually being treated at the gynae unit at the Mbalala Regional Cancer Center.
Generally, about 20 to 25 women are coming in the clinic for screening, and of those who come in daily for screening, we get about 1 to 2 confirmed cancer cases. So averagely, in a week, we get 7 to 10 patients who have confirmed cancer.
I started to realize that breast was growing smaller, and then it had a dimpling below. So that's when I felt like it was something serious, and I asked a friend of mine who was a doctor. So she asked me to go to another government facility, and I was asked to do a mammogram. I did a mammogram. It was highly suspicious of breast cancer. So I was asked to do a fine needle aspiration biopsy. Even that was highly suspicious, but not conclusive. After like a few months, I started to have backaches. So I did a CT scan, and it showed the cancer had moved to the spine. Yes, so I treated that. Then I started to have difficulties breathing, and then I did another CT scan, and the doctors again found out it had moved to the lung, the left lung. So the lung had tumors, and I had a fluid in the lungs.
Kwagana funa urine nga tejja bulungi. Kati nenzijjanjabwako, kati ate ne bagamba nti wali e Masaka wali Cancer Gundi Institute, ne bansindika eno e Mbalala. Kati obujjanjabi mbadde mbusanze nga si bubi, era mbadde ninawo enjawulo. Kubanga luli gye nali sifuuyisa bulungi, kati nfuuyisa, naye nga baŋŋambye ntala nyinkire bunyinkizi kwe gabo baagala kulabira ddala nga.
Our partnership with Uganda began with a shared commitment to improving healthcare accessibility and quality, recognizing the growing burden of cancer and the need for improved screening, and early detection. We saw an opportunity to make a meaningful impact. Working closely with the Ministry of Health and the Uganda Cancer Institute, we launched a 3-year with $3 million pilot project focused on cancer prevention, screening, and treatment. So our goal is to reduce the cancer mortality rate by improving early detection and strengthening Uganda's capacity to manage cancer crisis. So our efforts focus on early detection and accessibility. We have established mobile screening units to reach the communities, ensuring that women can access free cervical cancer screening services. And also, we have trained the local healthcare providers to enhance the early detection capabilities within existing healthcare facilities, such as Health Center 3 and 4. By integrating technology and innovative solutions, we are making cancer screening more efficient and accessible, ensuring that people receive the care they need as early as possible.
National Cancer Management and Capacity Building Project for Uganda. Because cervical cancer is the most challenging issue at the moment in terms of mortality, so the project aims to reduce cancer incidence by providing screening interventions at different levels of health care. We selected 20 facilities. In these health facilities, we selected a team of 2 nurses in each health facility. These are nurses or midwives. We selected 1 laboratory technician. We selected the health information assistant, which we call a data person, who manages data at the facility. We also selected doctors in facilities that have doctors. We all know that health center 4s have doctors, but health center 3s are managed by clinic officers and nurses. So the intention here is actually to train a doctor at health center 4 to understand interventions handling referred cases from health center 3.
For the time being, the project has been running. It started in 2023. It's a 3-year project. I believe that it has been able, or we have started to see some of its benefits, and we are trying to realize the objectives. For example, one of the objectives is to create awareness among the Uganda population in the different communities about cancer, about its prevention, services offered, and then the treatment. So I believe this message is being brought across slowly by slowly.
We are glad we have been getting support from Uganda Cancer Institute and the Korea International Health Foundation. They have been giving us support, and we have been screening, especially cancer of the cervix. A good number of health workers were trained on screening for cancer of the cervix, and we have been screening. In fact, we have a cancer screening clinic in our facility, and we also have an HPV DNA machine in our lab, which tests for the HPV DNA.
Most of these cancers, once captured early, they are treatable and they cure. The challenge we usually get is you coming to us late.
Depending on your age and then your gender, we need to screen for the common type of cancers regularly as recommended by the health workers. For example, when you're a woman, we encourage you and recommend you screen for cancer of the cervix and cancer of the breast.
So we need to do a lot as far as ensuring that we are screened early for the different cancers and for the other non-communicable diseases, if we are to be on the top of these conditions.
My last wish that this funding which the Korean have extended to us is scaled up to other districts, and it continues. We believe that several years down the road, we shall see a big impact when probably women no longer be dying of advanced cervical cancer. That is where somebody says we hope to end cancer in your lifetime. And for cervical cancer, it is possible because countries like Australia, which intensified immunization of young girls against HPV, and of course screening regularly, they have totally reduced this burden of cervical cancer in their population.
Cancer is preventable and treatable, especially when detected early. We encourage all Ugandans, especially women, to take advantage of these free cancer screening services provided through this project. At COFI, we believe that everyone deserves access to quality health care. So together, we can fight cancer and ensure a healthier future for Uganda.
This documentary is brought to you by the Uganda Cancer Institute and the Ministry of Health in partnership with COFI. Together, we are united in goals, unique in our needs.